Hello, let's discuss on amoebiasis or amoebic dysentery. Amoebiasis is caused by protozoan Entamoeba histolytica. These protozoa live in the large intestine and lower part of the small intestine of man. Let's discuss on the infections. Entamoeba histolytica live inside the intestine and feed on the bacteria that is found on the intestine and cause frequent constipations and diarrhea. It also invades the intestinal wall and causes intestinal ulcer or abscesses in the intestinal wall. The ulcer sometimes get burst, releasing blood and mucus, which comes out with stools, that is feces, causing acute dysentery. So the stool accompanied with blood and mucus caused due to the bursting of ulcer because of Entamoeba histolytica invasion is called as amoebic dysentery. The disease spreads through food and water and raw vegetables contaminated with the cysts of the parasites, that is Entamoeba histolytica. The parasites are spread by the flies that sit on the feces of the infected persons. So these flies, when come in contact with the food or water or vegetables, they deposit the cysts of the parasite, and when this contaminated food and water is consumed by the healthy person, the parasite enters the body and cause disease. The symptoms of this disease includes blood and mucus in the stool, abdominal pain, nausea, bowel irregularity with fatigue and headache. The preventive measures for this amoebiasis includes washing of hands before handling or taking meals and after toilets. The second includes protection of food and water from flies and cockroaches. Third is proper disposal of sewage and human feces, and the fourth is adequate cooking of food to destroy the cyst. The treatment of this disease includes administration of antibiotic medicines such as fumigallin, terramycin, aureomycin, etc. Now we shall discuss on the next disease, that is Ascariasis. Ascariasis is caused by roundworm Ascariasis lumbricoides. These worms live in the small intestine of man and suck the digested food. Man gets infected with this disease by ingesting the eggs of the Ascaris from the contaminated raw vegetables and waters. Once the Ascaris egg reaches the intestine, it hatches out tiny larvae called as the juvenile in a few hours. The larvae later grows into adult worm. The larvae on the intestine may even penetrate the mucous membrane and enters the portal system, which are carried to the liver and heart. Once reaching the alimentary canal, they causes infection in the intestine. Now we shall discuss on the symptoms of the Ascariasis. The symptom includes indigestion, abdominal discomforts, gastric ulcer, and accompanied with diarrhea, vomitings, and slight fevers. The patient may also become weak and anemic. The presence of this large number of worms may also cause blockage of the intestine, and this may destroy the intestinal wall and cause injury to even it may cause blockage to the intestinal wall, and sometimes it also cause injury to the lungs and the liver. The control measures of this Ascariasis includes disposals of human feces by underground sewage system. The second is thoroughly washing the vegetables and fruits before eating, and even protecting the food articles from dust and flies. And the children should be asked to wash their hand properly before having meals. Now let's discuss on the Filariasis, or Filariasis is also called as elephantiasis. Filariasis or elephantiasis is caused by filarial worm named Wucheria bancrofti. The disease is transmitted by the bite of Aedes or Culex mosquito infected with the filarial worm. The bite of this mosquito deposits the small filaria on the skin near the wounds through which the worm penetrates. The worm penetrates into the skin and reach the lymphatic system and start the infection there. The symptom includes the enlargement or enormous swellings of arm, foot, and other parts of the body. This enlargement occurs due to the obstruction of the lymphatic vessels by the worms. So due to this enlargement, the disease is also called as elephantiasis. The control measures of this elephantiasis or filariasis includes the destruction of the mosquitoes and their breeding places, and protection from mosquitoes bite and prevention from mosquitoes bites in order to prevent filarial infections. Now treatments. Treatment includes use of effective drugs like diethyl carbamazines and albendazole. So these are some of the effective drugs that are used for treating filariasis or elephantiasis.